You know, it's not uncommon for patients to complain about the cost of dentistry, so let me address this topic for you in today's video. Hello again everyone, and welcome back for another video. My name is Dr. Kenneth Goods and I'm a retired dentist from South Carolina here in the US. Now, if you happen to live in a country that has universal health care, then today's topic may not have much relevance to you, but for those of us here in the US, it matters. So I'm going to take a different approach on this subject today. Rather than talk about the business of dentistry and the costs of running a dental practice or the rigors of becoming a dentist and all that entails, topics that certainly do contribute to the overall cost of dentistry to you, the general public, I want to instead divide this video into two parts. In part one, I'd like to give a couple of examples from personal experience about actually practicing dentistry that make it cost what it does. And in part two, discuss some ways that dentists and the dental industry as a whole can do better to help our patients be able to obtain the dental care that they both need and in many cases want. Okay, part one, exactly why does dentistry cost what it does? Let me give you a couple of reasons. Reason number one, dentistry is a highly specialized field. The only healthcare providers that are trained to perform dentistry are, you guessed it, dentists. You know, in medicine, there's a decent amount of overlap as to who you can see for, let's say, a pain in your stomach. You have the choice to see your general physician, you could see an internist, or you could see a gastroenterologist. That's a doctor who specializes in the digestive system, among others, to treat your stomach. But if you have a tooth that hurts, you need to see a dentist. Now, according to the latest statistics from the American Dental Association, there are a little over 200,000 dentists in the US, with a total US population of 331 million people. Worldwide, the number of dentists is just under 704,000, with a global population of 7.8 billion people. Now, sure, any statistic can be distorted, but the bottom line is that the supply of dentists versus the demand for dentists creates an environment of increased cost. Reason number two, dentistry is very intricate work. Maybe you're a fan of high-end watches like I am, or high-end audio equipment. So you understand that the more intricate the work, the smaller the parts, the more craftsmanship that is involved, the higher the price. And whether you realize it or not, dentistry does fall in that category. Dentists are working on small teeth in a tight space, using small instruments with a handpiece, that's the drill, that can run as fast as 400,000 RPMs. Simply put, that requires a lot of skill, and that commands a higher fee. Reason number three, dentistry is very demanding work. Not only is dentistry physically demanding, as my bad back could testify, but it is mentally demanding as well. As I mentioned earlier, dentists operate under strenuous conditions. The mouth is a small, dark, wet environment, whereas ideal conditions would provide more space, more light, and dryness, the complete opposite of what we're presented with. That's why you'll notice your dentist is always asking you to open wider. It's why we often wear a headlamp to see better, and it's why we stuff cotton rolls in your cheek and under your tongue. Now, I didn't even mention the tongue. That is a whole nother challenge entirely, but we're moving on. Unlike our high-end watchmakers or other craftsmen working on an inanimate object, dentists are working on real live human beings with emotions and feelings who, let's face it, are usually nervous. They don't want to be there and are understandably concerned about experiencing any pain or discomfort. An already difficult task has just become that much more challenging. Now, let's finish up with part 2, and that is, how can the dental industry do a better job to help our patients get the dentistry they need? Here are a couple of obstacles that need to be overcome, in my opinion. Obstacle number 1, do you feel a connection with the doctor and his staff? Now this one might sound silly, but you want to know that your dentist cares about you and listens to you and has your best interest at heart. You want your dentist and the staff to have earned your trust and loyalty. If you don't have that connection, then you are not likely to proceed with any treatment recommendations, and you may actually start looking for a new practice to call your dental home. Obstacle number 2, do you understand what the purpose for your appointment is and what exactly is going to be done? All too often, that answer is no. I really can't stress this enough. Patient education is mandatory. You need to understand what your dental problem is, what happens if you ignore it, what will be done to correct it, and what to expect afterwards. Without all of this information, you simply can't make an informed buying decision. Obstacle number 3, does the dental office offer financing? This is a big one. Even when you understand the need for treatment, sometimes you just can't afford it. If you can't see a viable way to pay for your treatment, you're simply not going to proceed. For example, when you see a commercial for a luxury car, you're never told the price of the car, but rather the amount of the monthly payment. $50,000 for a car is a big number, but $395 a month is attainable in most cases. Unfortunately, patients have walked away from life-changing dentistry simply because they weren't shown a path to affordability, and it happens every single day, and it's a real shame. Dentists need to offer a combination of attractive financing through one of the several dental financing programs out there, use the patient's dental insurance to its maximum, or maybe setting up a monthly payment schedule with the remaining balance due upon completion of the treatment plan. By using some creativity, there should be no reason that patients can't afford the treatment that they need and desire. And last, but certainly not least, is obstacle number 4, and this is a sticky one. Do you, the patient, value dentistry? You know, it is widely known that people will gladly pay for something they value. They'll save up for it or maybe even sacrifice something else in order to achieve that desire, whatever it is. So here's a hypothetical scenario. Let's say your teeth needed a lot of work and someone gave you $10,000 in cash, free and clear. Which scenario describes you best? And remember, there is no right or wrong answer here. Scenario A, you immediately schedule an appointment with your dentist because you realize that a healthy mouth can affect the rest of your body's well-being, and that a nice smile can give you tremendous self-confidence that can help you land that better, well-paying job. Or scenario B, you head straight down to Best Buy to pick up the biggest, baddest television along with some sweet home theater chairs, or maybe you book that dream vacation, or maybe you pocket the cash because you may not really care at all about your teeth, as long as you can chew whatever you want without discomfort. Like I said earlier, there's no right or wrong answer here. It's just food for thought. What would you do? For that one individual, dentistry is well worth it because they value it. And for the other individual, it isn't. All right, folks, let's wrap up today's video. I hope you enjoyed it and learned something you may not have known before. Be sure to hit that subscribe button as well as the bell icon so you can be notified of upcoming videos. If you like this video, I would really appreciate you hitting that like button below, as it will help this channel grow. And well, if you didn't like this video, at least you're not sitting in the dental chair, am I right? Thanks again for watching, folks, and until next time, keep on smiling. Bye-bye.